At a time of crisis for the Montana State Hospital, some lawmakers see the budget surplus as a potential help in reversing the deterioration of mental health services in Montana. Montana State Representative Lou Jones, a Republican from Conrad, said Warm Springs is not producing the patient outcomes the state wants to see, and smaller regional facilities are overall better for patients.
And so as we look at addressing the situation in Warm Springs, to take care of those folks that are struggling with mental issues or severely mental ill, we also can potentially use some of this OTO dollars to bring this system more regional. We would have removed the burden of solving this problem from future generations, both the expense of it, and we provide better outcomes, and potentially when we reduce that ongoing spend, we could look to make a permanent tax cut instead of a one-time rebate.
Montana State Representative Danny Tenenbaum, a Democrat from Missoula, sits on the Montana State Legislature's interim Children, Families, Health, and Human Services Committee, which provides some oversight to the Montana State Hospital. Tenenbaum called Jones's idea long overdue.
A regional system of smaller care facilities spread across Montana would be a dramatic improvement for people living with mental illnesses and also their loved ones who want the best possible care for them.
Jesse Mullin, who is running to represent the Montana State Senate district encompassing the Montana State Hospital, said he's wary of Jones's plan because it implies reducing funds to the Warm Springs facility.
We absolutely need extensive mental health care across Montana. That doesn't mean that we have to reduce resources at the state hospitals. Now, if you were to say, let's regionalize the mental health care system while we also buttress Warm Springs, I would be completely on board.
Jones knows discussion of what to do will be robust.
You're going to have thorough hearings in front of committees. You're going to have to look at the unforeseen consequences, unintended consequences of change. And we certainly won't be able to not have the facility exist in its entirety. But what is the path forward? And if not now, when are we going to address suicide? And when are we going to address these mental health issues?
Montana State Representative Ed Staffman chairs the legislature's Children, Families, Health, and Human Services Interim Committee. Staffman said he was glad to hear Jones wants to address the issues at the state hospital in the next session. However, the state must take immediate action to help Warm Springs.
The department has been very interested in studying Warm Springs and studying rate structure, et cetera, et cetera. But it's not enough when your house is on fire. We need to take action now, and God knows we have the money.
In a July letter to Governor Greg Gianforte, the interim committee asked the state to raise Medicaid provider reimbursement rates this fiscal year as, quote, our mental health system will only continue to deteriorate if providers must wait another year for a significant increase in rates, unquote. Staffman said he would convey any response from the governor to the rest of the committee during their final meeting at the end of August. In Helena, Ashlyn Erbovig, MTN News.